Hi everyone, I want to share an update on our Surgimat. As you know, the Surgimat is a summary of your surgery. You'll pin it on the wall or on a cabinet in the surgery room. And instead of sending you a report with 8, 10, 20 pages that you have to pin up like graffiti, we summarize it in one sheet. And the update, there's a few, but the one primary one is that we have different angles of pins. So we have a sagittal, and then we have a cross section as well, so you can see the pins. We also have removed all of the areas down here where there were grids to keep track of your surgery. And I'm going to have the last form of the presentation here will show you where we moved it to. But on the Surgimat itself, we also modified a couple of views up here. We added the actual carrier guide in the multi-unit abutment view, so you can see the notch. The notch is where the screw goes in, for the implant trajectory, for the angled sites. And then where, of course, where there's no notch, it's a straight MUA as always. But this is a nice view at a glance to see which direction the driver is going to go, to make sure your abutments are oriented properly. And then we just modified this view here as well, which is the frontal view, to make sure your temp cylinders are aligned just as they are planned, right? So you look at the mouth, look at here, are the rotations correct? All right, so those are the main changes on the main Surgimat for the wall. And then the Surgimat, which actually sits on the countertop, still the same. Temp cylinders, multi-unit abutments, implants. Lay this down, organize all your parts for that particular arch in preparation for the surgery. Okay. Now the new form is what we took away from the wall, and we put it into a real simple 8.5 by 11 to keep track of some important data from your surgery. So you can put your implant sticker here from your implant container, right? Put it here, tape it here. Here you have the site number. You have the ISQ, if you've taken an ISQ, either on the day of surgery or this form is something to keep, so you can take an ISQ down the road. We have implant torque, right? We have abutment torque, but we also have new implant site. So let's say you had to change your implant in surgery, had to upsize or make something longer, you can keep track of it here. All right, very handy, because it does happen in different types of bone. And then collar height. So you ordered a particular collar height, but you changed in surgery, made one lower or taller. How important is that? It might be. If you're in the anterior and you may want to go a little bit lower later, you'll know what you used on the day of surgery, so you know if you can go lower or not. So this is a summary. This goes in the patient's chart. So instead of having it on a wall where you have to take a big picture of it, and then what do you do with the photograph, in the patient's chart, you actually have paper for the record, scan it in, whatever you like. So those are the Surgimat updates.